Hello, everyone. We're just beginning this webinar today called Cannabis Vaping Among Youth and Young Adults, Prevalence Trends, Needs for Intervention. We've got Dr. Dale Mantey, who's giving the presentation today. My name is Steve Kelder. We're both at the UTHealth Houston School of Public Health in Austin. We're going to wait a few minutes for others to join. I want to remind you this is a recorded session, and so if you know anyone whom you think might like to see this later, you can find it at the Michael and Susan Dell Center for Healthy Living website. So just give us a couple minutes and we'll begin the webinar. Thank you. Okay, I see that our attendee list is not growing so fast anymore. So why don't we just go ahead and get ready? Remember, again, this is Dale Mantey giving a webinar on cannabis vaping among youth and young adults. This is my name's Steve Kelder. We both work at the Michael and Susan Dell Center for Healthy Living, and this will be recorded, so you can tell your friends if you like the webinar to find it at our website. And you can see that we're being sponsored today by the Michael and Susan Dell Center for Healthy Living. Next slide, please. Thank you. The Michael and Susan Dell Foundation. Sorry about that. Our name is similar to the name of the foundation. And we're also at the UT School of Public Health in Houston, but Dale and I are here in the Austin location of the campus. Next, please. Thank you. And at the center, we have a lot of different things. And so you can see a QR code in the bottom right-hand side. But briefly, we have a website because we're the Center for Healthy Living, and we do a lot of work with child and adolescent health, families, and then communities too. So we have our website where you'll find lots of information. The webinars, you'll find them at the link that you see at the top center. We've got newsletters you can sign up for, blogs where we find different experts within our campus and outside our campus. We try hard to keep up on social media. We have a research and resources station, and remember that's on child and adolescent health. We do a lot of work in diet and physical activity. That's and obesity prevention and surveillance. And so substance abuse is we've been doing that one for a while too, in the area of tobacco control and marijuana too. We have the Texas Child Health Status reports and toolkits, and those were intended for elected officials or others who are interested in state government and policies and solutions that could work or might not work too. So visit our website at that QR code. Next, please. And then we have a couple other upcoming webinars. Physical activity, planetary health, equity, building synergies to maximize impact. That's coming up on Tuesday, April 30th. And then parenting begins before birth, new science of prenatal programming and early brain behavior development. And I guess I should have mentioned, just in the last year or two, although maternal and child health is of course important to child and adolescent health, we've developed a new set of expertise, hired new faculty, and have a bunch of projects that are of interest in the area of maternal and child health, where prenatal programming, early brain is one of the focal points. Next, please. So anyway, without further ado, I'll turn it over to Dale and his presentation on cannabis vaping. Take it away, Dale.
All right, thank you for that, Dr. Kelder. Yes, today I'll be presenting on cannabis vaping among youth and young adults. I'll touch on prevalence, trends, as well as the need for interventions. So let's give an overview of what we'll be talking about during today's webinar. So when we say cannabis use among youth and young adults, we'll talk about prevalence as a whole, so who's using, but we'll also talk about modalities and the health consequences. So it's how common is this? How are people using cannabis? And what are the consequences of that use? And then we'll go into the implications for intervention. We'll talk about what we know about youth and young adults using cannabis, and we can talk about how we can use what we know to intervene, to prevent, and to reduce prevalence as a whole. So let's talk about the national picture. Cannabis is the third most used substances among youth and young adults, behind alcohol and nicotine. So when we say youth, we're primarily talking about that middle school and high school age, 12 to 17, often described as adolescents. And then when we say young adults, we're talking 18 into 24, 25 range. So we're talking that emerging young adulthood. Among those two populations, again, cannabis is the third most used substance behind alcohol and nicotine. Every year, this is the most recent data from 2022, but this is pretty consistent. About 1.2 million youth and 1.2 million young adults initiate cannabis use per year. So we're talking almost 2.5 million per year in that age range are beginning to start experimenting with cannabis use. And so these are individuals that we could potentially target for prevention. Along with those nearly 2.5 million initiators per year, every year approximately 25% of young adults and 6.5% of youth are using cannabis within the past 30 days. So within the past 30 days is often what's described as current use. And so about 1 in 4 young adults are currently using cannabis, and a little over 6% of youth are currently using cannabis. Cannabis has been used quite a bit for quite a long time. Those prevalence numbers have been fairly consistent over time. However, what is changing is the modality through which youth and young adults are using cannabis. Specifically, vaping has become the modality of choice for young marijuana or young cannabis users. The modality of choice, when we say that, we can look first at this trend on the left. So this is from the Monitoring the Future survey. So it's an annual survey conducted among 8th, 10th, and 12th graders in the United States. And we see that with 12th graders, dating back to 2017, only about 20% of the of the 12th graders, high school seniors who had been using cannabis, only about 20%, so 1 in 5, reported using cannabis via e-cigarettes or vaping it. We see that by 2023, that number balloons up to almost 75%. So we've gone from just shy of 1 in 4 to now, or just shy of 1 in 5 actually, who are using cannabis via e-cigarettes, to now nearly 3 out of 4. So clearly, among this population, cannabis vaping has become the modality of choice. However, what we see here too is that so on the left, it's really a pinpoint on high school seniors, but when we really broaden it out and look at those youth age groups and that young adult age group, we see that, again, cannabis vaping accounts for about 50% or more of the overall cannabis modalities being used by youth and by young adults. But what we really see too is that this trend doesn't quite hold among older adults. So individuals 26 or older, we see that less than a third of them are using cannabis via or vaping cannabis as their modality. So what we're seeing here is that cannabis vaping is becoming exceptionally more popular, and that popularity is concentrated in our young cannabis users. Now I'm going to pivot to Texas in just a moment. So we've been talking about on the national scale, but now I'm going to pivot to talk about cannabis use among Texas youth and young adults. So let's talk about why a focus on Texas is necessary. First, Texas is exceptionally young. So Texas is the second largest state in the United States, but it's also one of the youngest. 1/4 of the state's residents are under the age of 18. So when we talk about adolescent health and preventing youth substance use, Texas is where a large proportion of those youth are going to be. And so our targeted emphasis on preventing youth substance use has to find a home here in the state of Texas. Beyond just the age, Texas is also the most diverse state in the country. So not only is Texas, not only is a plurality of the demographic of Texas or the population of Texas Hispanic or Latino, but also Texas is home to the largest population of African Americans of any state, and is also split geographically with a sizable proportion being rural, sizable proportion being suburban, and sizable proportion being urban. So Texas is not only one of the youngest states, it is also the most diverse state. And so as we focus in on addressing substance use among youth and doing it within an equitable framework, Texas is the home for that. So in order to research that and know how Texas youth and young adults are using cannabis, we rely on this very nice surveillance study, this large survey called the Tatum's Project. Where we recruited a cohort of youth and young adults, mostly out of the urban areas of Texas. So when you really think of the Texas Triangle, so Austin, DFW, Houston, and San Antonio. We collected 6 waves of data spanning spring 2019 into fall of 2021. And those 6 waves of data were collected in 6-month increments. So every 6 months, we do a new survey, and we're trying to ask kids, youth and young adults, how they were using both tobacco and cannabis. Participants were recruited within 3 age pockets. So you had 11th graders at baseline for 1 year post-high school and 3 years post-high school. So we have a good representation of latter high school and into that emerging young adulthood era. And so our sample was large and diverse. We had about 2,400 participants, slightly more female than male, and a little more than a third of the population in our sample was Hispanic, 15% were non-Hispanic Black, 16% were non-Hispanic other, and 32% were non-Hispanic white. And what we found is that in this sample, starting at baseline, so spring of 2029 or 2019, a quarter had ever vaped cannabis. And we see that just a few years later, 3 years later, that number had already doubled. So we see that among our youth and young adult samples here in the Tatum's data set, collected of youth and young adults here in urban Texas, we see that we go from 1 in 4 using cannabis, having ever vaped cannabis, to just a shade over half. And so what we're seeing here is there is this large increase, this monumental growth in popularity, more than doubling in the prevalence of ever cannabis vaping during this age. And what we also saw was that this trend was mirrored across demographic factors. So if you see on the left-hand side, we look at the trends of lifetime ever vaping cannabis by racial and ethnic category. We can see slightly higher prevalence among our Hispanic or Latino population. But what we really see is that while there are subtle differences in the prevalence, the trends mirror each other. They start at a relatively similar baseline percentage, between 19 and 27%. And then they end up increasing to every group ends up at 50% or greater by the end of the survey. And that prevalence is in range between 50 and 58% for each racial and ethnic category. So what we're really seeing, and then we see on the right, where there's actually a slightly higher prevalence among our female relative to male sample, but not statistically different. And so what we're really seeing here is that the trends and the prevalence of lifetime cannabis vaping, so experimenting with that substance, is really the same during youth and young adulthood by race, ethnicity, and by sex. There were some subtle differences actually by income, which is interesting. What we ended up seeing was that when we stratified by low income, middle income, and high income, we actually saw that there was a greater prevalence of use among our low income participants, but that just below them were actually our high income participants, with our middle income youth and young adults actually being significantly lower. And so the prevalence was lower. The trends were less steep. And so as you can see, the difference here in ever and lifetime use started to differentiate themselves between youth and or between high income, low income, and middle income. And so so while there don't appear to be any demographic differences by race, ethnicity, and sex, there do appear to be some potential economic differences here. Further studies going to need to explore that in detail, but it was something worth showing here in our presentation. So what we had just talked about were the people who had just ever experimented with this, if they were going to try cannabis, they did so via an e-cigarette. But then not everyone who starts using continues to use. So it's very important to know about how many people go from never using to experimenting to sustained use. And what we ended up seeing was that over the course of our study, all 6 ways of data, we ended up with about 13.5% who were vaping within the past 30 days. That number, that prevalence varied between 10 and 16%, but it was very tightly within that range at each wave. But what we saw very consistently was that 1 in 3 of individuals who had ever experimented with cannabis vaping continued to use. So 1 in 3 people who are 1 in 3 youth or young adults who began vaping cannabis continued to do so as they grew older. And more importantly, we saw that, or equally as important, is that 10% of the people who were using and vaping cannabis, nearly 10%, 9.5%, were vaping daily. So they were not just experimenting, not just frequently using, but they were using the substance every single day. This is critical to understand because as one of the primary, and we'll get to this in the next few slides, but one of the primary concerns with cannabis vaping is the risk for dependence or cannabis use disorder. And so one of the primary symptoms of use disorder is the frequent and daily use of the substance. And so having 9.5% vaping cannabis daily is a clear indicator that this substance is generating symptoms of dependence, and that our sample is reporting symptoms of dependence at a very high rate. It's one thing to know who's using cannabis and how they're using it. It's another to discuss what are the health and social consequences of cannabis use. First, cannabis use inhibits healthy brain development. And though the biological mechanisms through which this occurs is not fully understood, we do know that cannabis use during adolescence lowers the white matter integrity and thinning of the cerebral cortex, resulting in excessive neural activity, which has been linked to a series of negative health outcomes. These negative health outcomes include increased risk for depression and anxiety, particularly as children age into young adults. We also have found that cannabis use is significantly associated with reduced academic performance. And so we're seeing that cannabis use can be linked to mental health disorders as well as poor academic performance. These are essential factors for understanding the overall consequence of and risk that can come along with cannabis use during youth and young adulthood. What we see often is that the self-reported reasons for using cannabis during youth and young adulthood can actually often be to mitigate symptoms of depression and anxiety. However, the data clearly show that while there may be brief and acute attenuations of low affect or poor feelings, depression, etc., the use of the substance actually exacerbates symptoms in the long term among youth and young adults. So that's the direct understanding of the health consequences of cannabis as a whole. But however, we're talking about cannabis vaping, right? And one of the most severe consequences of cannabis vaping has been EVALI, or the vaping-associated lung injury. So in 2019, EVALI caused over 2,400 hospitalizations and 50 deaths. The final death toll was actually closer to 70, and the hospitalization rates, I believe, were over 3,000 by 2020. But this was not even cases and deaths, mortalities related to EVALI were not evenly distributed. So 75% of the individuals who ended up getting EVALI and having permanent lung injury were under the age of 35. So EVALI was, by and large, a disorder that was experienced by young people. And with that, the CDC found that the overall cause of EVALI was vitamin E acetates, which is a thickening agent used in illicit cannabis products. So that led to EVALI. So individuals were vaping illicit cannabis products that had a thickening agent in it that was not safe for consumption, was not safe for vaping and inhalation. And that ultimately led to the spike in EVALI, or the onset of EVALI, as a public health concern and a public health crisis. This is particularly relevant to states like Texas, where cannabis prohibition, where in states with cannabis prohibition, EVALI was between 3 and 7 times more prevalent relative to states where cannabis was legal for adult use. And so when understanding when contextualizing the EVALI outbreak, we must understand that state level regulatory policy does play a role. And we must understand that because we are in a state where cannabis is still prohibited, the next EVALI outbreak could be right around the corner. Beyond the cognitive consequences and beyond the EVALI consequences, cannabis use also has a series of legal and social consequences. So cannabis is still federally illegal. It's a Schedule I drug. It's also illegal in, I believe, 20 states still, or maybe it's 15 now, including the state of Texas. So cannabis is illegal. And this means that there are legal consequences for use and possession. Felony charges that can carry up to 1 year in jail, as well as thousands of dollars in fines, but also the loss of eligibility for federal aid for higher education, as well as other federal programs. But when we're talking about youth, we're talking about young adults. It's very possible for them to, if they are caught in possession of cannabis, they can receive a felony charge, thousands of dollars in fines, and be made ineligible for receiving federal aid for higher education. This brings about very real, tangible, quantitatively measured social consequences, from school suspensions and or expulsions, so kids being removed from the classroom, but also long-term reduced economic and social mobility. A youth or a young adult who is unable to afford higher education and unable to receive aid for that higher education will be limited economically and socially. And so understanding that if cannabis is at the root of that ineligibility, that means cannabis is at the root of those social consequences and are thus something that we must focus in on as an overall goal of preventing the use of the substance. So given all of that, given the rise in prevalence, given the consolidation of use within the e-cigarette modality, SAMHSA has recently issued a call to action and outlined a report on how to prevent marijuana or cannabis use among youth. This report emphasized community engagement. So that's the first part. It's talking to communities, understanding what are the problems, how are kids using cannabis, how are they accessing cannabis, what are their perceptions and thoughts about cannabis. But beyond that, it's understanding financial sustainability. It's one thing to have a prevention program that works. It's another thing to be able to keep it going. And so this report discusses in detail the need for discussing that financial sustainability. It also speaks to tailored interventions. So not all locations are the same. The easiest one to discuss is differences in regulatory policy. So some states, cannabis is legal for adults to use. Some states it's just medical, and other states it's fully prohibited. So in prohibition states, those interventions may need to be tailored versus in adult use states. And then also the importance of training staff or disseminating any sort of intervention. The important thing to consider here is that SAMHSA's program or call to action, one of the things they emphasize heavily is not to reinvent the wheel. While cannabis is becoming legalized in some locations, not so much in other locations, it's becoming clear that we can use established evidence-based frameworks to inform control efforts. Tobacco control efforts being one of the more successful and one of the more applicable to youth cannabis prevention. So those Those control efforts include, policy, enforcement, taxation, things like that. That assumes legalization, of course, but then also communication campaigns and school-based interventions. It's important to know that you have to change the norms, the perceptions, and the discussion, the general conversation around cannabis in order to effectively implement an intervention that's going to make any real dent in youth cannabis use and young adult cannabis use. So it's one thing to have a framework, but what do we address when trying to prevent youth cannabis vaping? Well, the first thing you do is find, well, what predicts it? What's the biggest determinant that we know of for whether or not a youth or young adult is going to start vaping cannabis? Well, the biggest predictor that we found so far in the literature is vaping nicotine. So kids who vape nicotine are way more likely to vape cannabis. There is a series of systematic reviews and meta-analyses that have demonstrated that. But also, if you just look on the right here, this bar graph will walk you through exactly what the differences are in prevalence of lifetime cannabis vaping. In the blue bar, you see that of youth who have never vaped nicotine in their life, of all of them, only 8% had ever vaped cannabis. But of the youth who had ever vaped nicotine, 60% had ever vaped cannabis. So this disparity here, it's a clear indicator that we're talking about a 7.5 times risk factor, a 7.5 multiplier of vaping nicotine into vaping cannabis. Our systematic reviews, our meta-analyses have found that when you adjust for covariates, that falls down to only about 3x, a 3 times multiplier, but still, kids who vape nicotine are over 3 times as likely to start vaping marijuana or cannabis than the kids who have never vaped nicotine. This is one of the most consistent and strongest predictors, and thus it's an important consideration as a determinant for prevention. Beyond just the overlap in behavior and the temporal relationship between first beginning with nicotine and then transitioning to cannabis, beyond that, we see that the similarities between nicotine and cannabis vaping are really vast. First, the rapid increase in cannabis vaping really mirrors the rapid increase in nicotine vaping that occurred really about a decade ago. So if you think 2014 is when nicotine vaping or e-cigarettes became the most common modality for using nicotine, is 2014. It went from a relatively uncommonly used product to the most common way kids were using nicotine. And now we see that with cannabis, it's the same. It went from a relatively unused product to now the leading modality with which kids are using this substance. And so we see that there's an overlap in the actual device, but not only is there an overlap in the device, the reasons for using these substances via that device are very similar as well. First, consistent is flavors. The kids like to use nicotine with flavors. There are flavored cannabis products as well. But beyond the flavors, there's also the concealability of vaping relative to combustion. So if you're a young person, you're not supposed to be using cannabis at all. You have an incentive. A product that can be easily used in a concealed way has a relative advantage to the products that have to be lit up, and they have smoke and they have a certain smell. And so kids are gravitating towards the vaporized product. Beyond the concealability is also the ease of use. So one of the, with a vape product, it's very easy to take, have it in your coat pocket or your jacket pocket, your pants pocket, pull it out, have 2 hits and move on. And it's like it never happened. Meanwhile, if you want to smoke or have some other kind of modality for cannabis use, it's a ritual. You have to find a place to do it. You have to light up. You have to either finish the product or store the product. Meanwhile, with a vape, it's plug and play. It's ready to go when you are. And so that level of ease of use has really driven the prevalence. And then the most obvious answer too is that one device can be used to aerosolize both products. So you have a one vaping product. If it has certain pods or certain mechanisms, you can take one out and put the nicotine cartridge in, take the nicotine cartridge out, put the cannabis cartridge in, same device, one device, two substances to be used. So because of this overlap, we're really seeing that addressing nicotine vaping or incorporating cannabis vaping and nicotine vaping into a harmonious intervention has plausibility. Beyond just all of that, there are also a lot of social and cognitive shared risk factors. So the determinants here, things like social norms. So youth who live with nicotine vapors, people who vape nicotine, are still more likely to vape cannabis. We believe that that may have something to do with the modality component to it, the normalization of the products. But we also see that even beyond the products, we see that how youth perceive their social environment, particularly things like parental monitoring, have a similar and shared predictive nature for initiation and continuation of nicotine vaping, same as cannabis vaping. Same thing with harm perceptions. As a youth's perceived harm of one product goes up or goes down, their odds of using the product go up inversely. This overlap and blending of social cognitive determinants within the same modality really provides a theoretical and practical justification for addressing these behaviors via one intervention, a universal intervention. And so let's talk about a potential integrative intervention. The Catch My Breath project, e-cigarette program. It's funded or founded in social cognitive theory, and it has it's for grades that are anywhere from 5th grade all the way through seniors in high school. It has 4 age-appropriate lessons, so the lessons are divided by each grade, and there's 4 core lessons, each available in English and Spanish, that are currently being used in over 2,500 districts with a single simple infrastructure for how to actually download and the product, how to download the modules, how to download the teacher trainings. It meets federal and state educational standards. It's evidence-based. It's been published in the literature, not just by the University of Texas, but other organizations, other institutions have also implemented and evaluated and published their results on the effectiveness of the program. And it's endorsed by a series of reputable organizations, most of which is SAMHSA. So the same organization that's issuing the call to action for cannabis vaping has actually endorsed and recommended Catch My Breath for nicotine vaping. And so what we're talking about here is potentially integrating a cannabis vaping prevention program into existing school-based vaping programs. Catch My Breath has been implemented in over 5,500 schools all over these great states. It is the statewide program for West Virginia and for Idaho, but it's also been implemented in 90% of the largest districts in the United States. So that's the New York City Public Schools, that's certain places in California, Florida, and Texas as well, including Houston. So beyond just the wide implementation and the effectiveness of this nicotine vaping program, we have over 7,500 trainers that are implementing the programs within their community with a train the trainer model so that we can increase sustainability. The components again include 4 lessons as well as a parent toolkit. There's additionally more online. But we have now started, because we have that great nicotine vaping infrastructure, we have started pilot testing a cannabis vaping lesson. Right now, it's just 1 lesson. We currently have that in the field. We're pilot testing it as we speak, and it includes a discussion of knowledge about the health impacts of cannabis vaping, social norms and outcome expectations for not using cannabis. So while there is a high rate of cannabis use among youth, it's still a sizable minority. So in other words, most kids are not using cannabis. And so we make it very clear in our modules for other kids to know that, is that the norm is to not use. And so when trying to discuss, peer pressure and what's the normal thing to be doing, we make sure we reinforce that most kids are not using this. We also have group activities to practice refusal skills. It's really important that we understand that it is possible that kids are going to be asked to use or going to be pressured to use. And so it's important that they understand not just why it's important to say no, but how to say no. And as you can see on the right, there's a nice, we do a pre and post test as part of one of the activities within this module, where we have kids just simple questions, can cannabis use cause any sort of dependence, for which we give them the clinical term, which is cannabis use disorder. We also talk about the impact of cannabis use on mental health and brain development. We overall give them an idea first on what do they think is true. Then they go through the lesson and they re-answer for what they find out is true. If you would like to, on the QR code on the far left of the screen, can take you to the Catch My Breath website, where you can navigate and you can get the nicotine vaping program, but also more information on the cannabis lessons or single lesson. But this is a nice screenshot pull, or one of the slides included in our cannabis vaping program that we're pilot testing right now. So we discuss, what is cannabis as a whole. We let them know it's a psychoactive drug, but we also talk about the different modalities. So while our program is specific to vaping and talks more about, that specific modality, because that's how the kids are using the product, we do actually incorporate a discussion of combustible or flower cannabis, as well as edibles. So yeah, that is what I have so far. That is what I have for today. If you have any questions, you can view if you'd like to see our other webinars, this is it. But I guess we can turn it over for questions now. And this is my contact information as well, if you'd like to get a hold of me for more information.
Very good. Thank you much, Dale. Appreciate it, or Dr. Mantey. Now, as he mentioned, we will have some questions from those of you who are out there. So let's see. I'm not seeing him yet, so I hope I'm looking at the right place. But anyway, if you have any questions for Dale, please put them in the chat, and we will try to get them answered. Oh, okay. I was looking in the wrong place. There are a number of questions. Let me look at them. One question, Dale, Dr. Mantey, is how would making cannabis legal help alleviate the E-Valley outbreak?
Yeah, that's a great question. Really, it has to do with regulation. The biggest component to this is that when there is an illicit or dark black market, anyone can add anything to those substances. Really, let's think of the E-Valley outbreak we experienced. No one's been brought to justice for that. No company has been held to account for that. And the reason for that is that there is no overall regulatory body to enforce that. Inversely, what we would see and would imagine seeing, and what the data bear out there, is that by having a regulatory body that's there and either inspecting, doing quality assurance, and doing a series of other regulatory enforcement, it's very likely that we would see a reduction in the probability of any sort of outbreak such as this. Really, it's that relying on the literature, which has shown us that the Valley outbreak was just disproportionately 3 to 7 times more common depending on the state, and the way depending on the state, 3 to 7 times more likely in states that prohibited cannabis.
Here's another question, Dr. Mantey. Are there any plans to repeat the data collection in rural areas?
Yeah, beautiful question. Right now, we are working on a potential opportunity, or we are working on some grant opportunities for that. So these large surveillance projects, they're grant funded, they're very expensive and that sort of thing, and so we have to work very hard to secure the funding for that, and we're trying to do that as we speak. We're discussing potential ways of exploring the rural population. With rural Texas, I was born and raised in rural Texas. There's a lot of it, especially in terms of space. And so the answer to that question is absolutely. We're very interested in it. We're trying very hard, and it'll all depend on how the grants go.
Great. Here's another one. Could the Texas hemp law be explained? Are you familiar with it, and can you talk about it? And then specifically, vape vape shop stores, they're selling Delta 8 or other CBD products. So how does that work? Do you know?
So I am not going to claim to be necessarily the expert on the hemp laws. I know that there's I've been on some webinars, I've been on some trainings, even held by attorneys and folks like that who have done their best to explain the regulations. But it seems like the primary answer first is that there seems to be a lot of confusion. What is legal? What isn't legal? So it's very clear that your traditional Delta 9 THC is still illegal in the state of Texas. However, hemp and Delta 8 and other things like that are not. But in high enough concentrations, Delta 8, which is derived from the hemp plant, I believe, is in high enough concentrations, can have a psychoactive effect similar to or akin to Delta 9 cannabis. So Delta 9 is your traditional, at least I believe, Delta 9 is your traditional cannabis product when you think of cannabis, right? And Delta 8, which is derived from the hemp plant in high enough concentrations, can generate a similar psychoactive effect. I don't know enough to speak as to like what that law was intended to do versus what it is doing, but it's very likely that those products, because of has a very it's just higher concentrations of a very similar chemical, is my understanding of it from an epidemiological perspective.
Yeah, and if you know of any sources of information that you might be able to put in the chat box, or possibly we can look it up and put it out as an afternote for this webinar.
I can do that, absolutely.
That is a good question. I think what I'm hearing you say is that there might be a loophole with regard to the regulation and the enforcement of cannabis in Texas, and that loophole may stay open or it may be closed, or that's part of the difficulty in trying to understand this whole situation.
Yeah.
Here's another question. Do all of the modality stats include edibles? So you presented information about that.
They do. So the way we were presenting our information was if you took just as like the denominator would have been all the people or all the youth who use cannabis, right? And so we say, did you vape it, yes or no? And we sorted them based on that. So some of the kids vaping cannabis were also using edibles. Some of the kids not vaping cannabis were also using edibles. So we weren't splicing the data at all to say this is a prevalence of edibles or this is a prevalence of only edibles. We weren't necessarily talking like that or presenting data like that. Instead, we were so yeah, we weren't presenting those data, but yes, some of the data do have edibles. Now that's that the surveillance overall is becoming less or is finally catching up. So it took a while to get nicotine or cannabis vaping incorporated into large surveys. We're only while ours has gone back several years, national surveillance studies have not. They've just recently really started asking the questions, and so edibles are kind of following that. We're finally getting those questions. So I believe that monitoring the future, which was the one where we just focused in on high school seniors, monitoring the future has been asking about edibles for at least the past 2 or 3 years, but I'm not sure about any other large national surveillance studies. So if you're really interested, especially in edibles and the prevalence of such, I would highly recommend the monitoring the future data set.
That's great. That's great. Here's another one. Are you aware of any parent education programs that schools or others could use, parent groups?
No, not yet. I'm not saying that they're not out there. I'm not aware of them, but we are working on ours. So with our nicotine vaping programs, we have a parent toolkit that can accompany it. So schools who train their teachers on the e-cigarette or on the Catch My Breath program can also download a parent toolkit that they can send home with their students, or send direct. It's available digitally, so they can actually email it directly to the parents. We're working on a accompaniment of that for cannabis, where we'll talk about, much like we do with nicotine, a handful of different components. So with that, it'll be knowledge based. So like, this is what cannabis is, this is how kids are using it, this is how to detect it, but then also conversational aids. So discussing the importance of having these conversations with kids, setting rules and enforcing rules, and having a stated household rule and policy on, hey, we don't use that substance in this house, that sort of thing. We're going to be incorporating that, and it'll go live. We're hoping by the end of this year, but it may be next.
Here's one, Dale. Can you flip back to the slide that has your contact information, please?
Sure. Yeah, shoot
Somebody
me
loves you out
an
there, Dale.
well, let's hope. We'll wait to see what they say. Yeah.
Here's another question. What is the difference between THC vaping and cannabis vaping?
THC vaping, cannabis vaping, I would call them those synonyms. I don't think that there'd be a difference between the two.
I will say that I've read that early versions of Juul came from a company called PAX, and they had a heat not burn marijuana where it didn't combust, but it aerosolized the THC. And that was some of the beginning stages of the vaping that we see now, where instead of the cannabis leaves, it's the cannabis oil or the THC. So I don't know much else about that PAX Corporation or heat not burn, but in the tobacco world, heat not burn devices are now becoming more and more popular as a harm reduction strategy for tobacco combustion. Sorry, I answered your question.
No, good.
Let me see about any others down here. There's some more. Thank you for the wonderful presentation. You mentioned the negative effects on white brain matter in youth, but is this also being seen in adults or late onset users?
Yeah, so the literature is not nearly full. So cannabis being prohibited for so long in all states and on the federal level, we are working with very limited data. But to answer your question directly, we are not seeing the same degree of impact on adult users or sustained users. What we're really, the answer is it seems to more negatively impact youth and young adults. The reason for this is that that is an era where the brain is still not just developing, but developing a lot every day, rapidly still, relative to in your 30s or even beyond. So we have not seen, to my knowledge, the same degree of impact on adults, especially for brain development and brain structure on adults relative to youth and even young adults. That said, the impact on mental health outcomes, I want to emphasize this, while cannabis has not been linked to a worsening of health outcomes or mental health outcomes in older adults, it also hasn't been linked to improved depression or to improve anxiety or anything like that. Inversely, it has been largely linked to worsening and severe mental health disorders or symptoms, maybe not diagnoses, but symptoms in youth and young adults.
Yeah, if I can piggyback on that, I did read a paper recently that demonstrated that chronic heavy marijuana users have a propensity towards schizophrenia if you already have a behavioral health issue. I'm not sure we know why in the brain that is and how the actions work. That's not my field either. But I did read the papers in epidemiologic study that evidence is becoming more clear in terms of, but then again, this is chronic, long-term, heavy users is what we're talking about. Here's another question. Do you have any information on cannabis vapes laced with fentanyl? We've been hearing concerns from community members. Though when you look online, you can find conflicting information about the extent to which this is occurring.
Yeah, I'm not aware of that. I mean, I think I've heard, stories before. I'm not aware of any case studies in the published literature on that. I can't say confidently that it doesn't occur, but I've not seen anything in the published literature. I haven't seen any case studies on this. So we did a large review of like different case studies. So one offered maybe a cluster of different patients presenting in emergency rooms and physicians' offices as a result of Valley and as a result of I forget the clinical term of this, but where they ingest too much cannabis and have need to go to the ER, right? Intoxication of sorts. And with that, I haven't seen anything in the published literature as it pertains to fentanyl or fentanyl within cannabis vaping specifically. So I haven't seen it, but I can't say confidently that it doesn't occur.
Yeah, well, you know, just to let the questioner know, a couple of weeks ago, I did a webinar on fentanyl in kids, and there's a Texas state law called Tucker's Law, which now requires state public schools to discuss fentanyl with their children within the context of their health education program. So Tucker's Law is, you can look that up on our website with this QR code. But I did not see that specifically. But you know, the problem, one of the problems with fentanyl that really scares me, it makes me glad that it wasn't around when I was a kid, is that it's such a small thing. I mean, very, very little can get you high, and it's easy to OD, and it can come in powder form or in liquid form. So it could be laced in marijuana without too much trouble if you had access to the fentanyl. It's frequently put into tablets that look like regular, you know, ADHD medications or real medications that are fake, but the fentanyl can be found in there. So it is a concern. I have not seen data to say how big of a concern it is with marijuana, but I myself have talked to my children that, you know, the world is a lot less safe today with regard to street drugs, and I wouldn't take a street drug from anybody these days. Not that I do, but as a matter of fact, where is it? I bought a supply of Narcan to give to my college-age son as a preventive measure. They're inexpensive, and that could be a life-saving situation for some people. If you're walking down 6th Street on a Saturday night, maybe having a Narcan wouldn't be such a bad idea. Okay. Do you also think the reason vaping is so popular is because it appears to be cool?
Yeah, I mean, probably among kids, especially. There's growing literature now that shows that it's kind of losing its popularity to some degree, or not losing its popularity to some. I think the answer is probably yeah. I mean, if you're, I don't know enough. I don't think I've ever been cool enough to be an expert on that word, but I would say that probably. I mean, it has something to do with that. It's all, you know, it's the modality of choice, and so like it has to be some degree of, by definition, popularity. And so I think that could be it. I mean, maybe it just is.
You know, there's a Netflix show on the rise of Juul, which does include the strategies that they use to create advertising that was specific to younger people, and that's the central theme of the settlements which have happened recently in the last year with Juul and Altria paying communities, school districts, and such. And so I might recommend that film. I believe it's on Netflix. Here's another question. Isn't it true that because nicotine and marijuana can be vaped, can vaping marijuana, getting high, can you do it while driving?
I mean, you can, yeah, absolutely. I mean, that would be, I mean, consider, you know, I mean, yeah, I mean, absolutely. You know, if you're driving as easily as you can text and drive, you could probably vape and drive, because one hand on the wheel, one hand on your electronic device, and that's as simple as that. You could absolutely do it. I wouldn't recommend it. It's definitely a negative. It's going to not only harm your health, but you know, driving inebriated is not only illegal, it's incredibly dangerous for yourself and for everyone around you. So I would recommend highly not to do that. But could you physically? Absolutely.
Here's another question. Thank you so much. Have you guys heard about the Stanford Medicine Toolkit in cannabis?
Yes. So Stanford has a wonderful program and project. They have a similar nicotine vaping or tobacco control toolkit similar to the Catch My Breath one, and their cannabis vaping one, or the cannabis program, is out there. It's also so ours is a bit more specific. While ours is general enough for all of cannabis. It's very specific to the modality of vaping. While I believe that, I could be wrong here, but I believe that the Stanford one is available as well, with a more general and broad approach to cannabis as a whole, is my understanding. And so they can very much so complement each other in that way.
Yeah, the Stanford program is great, and it is one that's mentioned by SAMHSA for marijuana prevention. So
Absolutely.
it's on the board for sure. Have a look at it. Let's see. Are there any more questions? I think we answered all the questions. I'm sorry, you answered all the questions, Dr. Mantey. And so, without any further questions, or any last thoughts or comments that you want to give the folks who are still on the call?
No, I mean, I would highly recommend, if you're interested in knowing more about prevention in your community, to reach out to us, to reach out to the Catch Global Foundation. And if you have any other questions, here is my contact information. So feel free to reach out to me, and I'd be happy to answer as quickly as I can.
Great. Well, thanks everyone for joining us. Appreciate your continued support of attending these webinars. We're going to keep having them one after another. So maybe we'll see you next time. Thank you very much. Bye-bye.
Bye, everyone.